In our first story, some health facilities in the country have begun the co-payment system where subscribers of the National Health Insurance Authority are made to settle part of their health bills. The system, adopted mainly by privately owned facilities, is informed by the delay by the National Health Insurance Authority to pay outstanding claims. The Mother of God Hospital at Ashaman here in Accra is one of such facilities. Its executive consultant, Dr. Abel Franklin Mensah, speaks about their frustrations with the NHIA.
You see, you can countenance things for some time, but when it's becoming overly overwhelming, then you would have to take a decision. For instance, if you have negotiated for loan to expand your facility and you have to use part of the money to buy drugs and the monies will be kept for 10 months, if you're a smart businessman, you should know that it's not going to help you. You have to put a stop to it. Therefore, we can't continue financing our operations without being reimbursed. Therefore, we decided to go this way.
So, for how long have the NHI not paid?
For our facility in general, I can't really say for other people, but for our facility, up to date, 10 months. And let me correct this impression. You mentioned that we are running cash and carry. We actually not running cash and carry. We are running what we call quasi-active national insurance scheme. The association actually decided that we should go cash and carry, but you see, every facility can turn it around a bit. In order to cushion our clients a bit and stay connected to the scheme, we opted for quasi-active national insurance scheme.
In a separate development, the 37 military hospital has denied claims it is partially charging patients for treatment. A notice purportedly posted on the walls of the hospital indicated that patients will be expected to pay part of the bill, whilst the NHIS takes up the rest. Acting Public Relations Officer Joanna Sapi, however, dismissed the claim.
Well, we actually saw the notice pasted on the wall, but the hospital hasn't got anything to do with it. It was just a brief discussion as to see the way forward for the hospital.
The way forward as
in NHIS charges. And for example, when somebody goes through a cesarean section, NHIS pays 175 to the hospital. But when you calculate everything, it amounts to over 600 cedis. So that means the hospital is losing. So this was just a brief discussion to see the way forward, just to see the smooth running of the hospital.
So does it mean that the hospital is also considering this issue about co-payment too as well?
No, not at all. The hospital hasn't asked anybody to pay for the hospital fee. That's NHIS will pay part and then the hospital too will pay part, or the individual too will also pay part. The hospital hasn't said anything like that. Okay. Currently, there are a lot of patients who visit the facility daily. We have about 2,000 plus patients visiting the polyclinic alone, that's the civilian polyclinic, and other departments. So let's say we have over 3,000 or 5,000 patients visiting the hospital in a week. So when you look at this figure, you will notice that if NHIS is giving just a small amount to the hospital and we are bearing the higher cost, that means the hospital is losing.
While some NHIS card bearers who visited the 37 military hospital on Monday morning told Joy News they had to pay cash for some of the services they received.
Dr. Isaac Morrison says they have been compelled to come to this decision because of the persistent failure of the NHIA to settle its obligations to them. He says the amount due them covers claims for more than 6 months and that the cash and carry option will be the only way to save the operations from running aground. Implementation of the decision will see NHI subscribers paying outright cash for services rendered them or being made to pay for some services whilst the authorities build with the rest.
July. Some have just received July, others are yet to receive July. So for August, September, October, November, December, technically everybody's owed. Some have folded up, that is one. Others sought interventions from their bankers by way of, asking for overdraft facilities, etc., in the hope that at least there will be some regular payments so that they can offset. And I'm sure, I have a meeting again this afternoon with NHI, and we'll see how it goes.
What are your members saying now? Because I know some health facilities, for now, the NHIS only covers consultation. Is that the position of your members too?
Well, the position of my members, as at the time we had that, shall I say, resolution passed somewhere in February, was that we should be paid all our arrears by the end of February. Failure, then we resort to cash and carry.
The National Health Insurance Authority is unwilling to comment, but admits owning a number of these health facilities. It says it is working on settling them. It, however, says the failure of some of the health facilities to renew their expired credentials is partly to blame for the delayed payments. But President of the Society of Private Medical and Dental Practitioners is challenging the claim.
Have you checked whether both public, private, quasi-government, everybody had at a point in time not renewed their mandate, their contracts? That's all I'm saying. We had all not. It is not the case that, for example, maybe Mamobi Polyclinic or Fanchiniko government hospital had renewed. All had fallen short. So but you were exactly. That's unfortunate. And the posturing of some of their members in authority makes it as though the private sector is not wanted. If it's not wanted, let's have it. Let's have that understanding. Then we know exactly what to tell our members, how to move forward. So once
And we apologize in the mix-up of stories. That's the Society of Private Medical and Dental Practitioners who are threatening to go ahead with plans to demand cash payments or cost sharing from the National Health Insurance subscribers over delays by the authority to reimburse them for outstanding bills. And we heard from its president, Dr. Isaac Morrison. Let's move over to the Kolebu Teaching Hospital now, because the continuous closure of the Central Sterilization Services Department of the Kolebu Teaching Hospital is causing anxiety among doctors there, who say they are frustrated by the lack of equipment to operate. The sterilization machine has been out of use for the past 4 weeks, and though the hospital administration says alternative arrangements have been made, the doctors say they are insufficient. One of such is orthopedic surgeon Dr. Fred Salau, who opens up to Joy News' Kwete Nate about the challenges.
The Central Sterilization Services Department is the main unit at the hospital, which ensures that reusable equipment deployed in surgeries are free of all forms of contamination. The CSSD autoclave machine broke down 4 weeks ago, and the hospital authorities have assured it will be fixed by the end of April.
Work is going on. A contract has been awarded for the replacement of the faulty parts, and then we hope that before the end of next month we'll have the place fixed for them to resume normal operations.
The hospital's PRO, however, stated that alternative arrangements have been made to make the equipment safe for reuse.
The breakdown of the autoclave machines at the CSSD does not mean that we don't have any other source of autoclaving materials for theaters. We have other autoclave machines spread across the hospital that we use at various theaters, the pediatric surgery theater, surgery unit theater. Also have the first floor theater where we have another autoclave despite the fact that the capacity there is not as huge as the main CSSD unit. But they are helping. But sometimes when there's a need, we also fall on other sister hospitals within the metropolis to help us to autoclave materials for the CSSD unit.
But the doctors say the options have not helped and that they have become redundant due to the absence of their tools.
The number of people who come to this hospital every day is more than the instrument that we are sterilizing. So they go and sterilize 1 and 2, and some don't go at all. Okay, so by the time you get to theater, everything is finished. As of today, everything is finished. So we just have to cancel the list.
How often are you compelled to cancel cases because of what's happening?
It's just started when the CSSD got broken down. Before, when the CSSD was working, we were having once a while it gets broken down. But we could cope. But now we can't cope with it. That is for now, we can't cope.
Orthopedic surgeon Dr. Fred Salau says many patients have been turned away even though there were doctors willing to work.
We are talking about instruments and gowns to operate on patients. The CSSD has broken down. It is not working. We have patients who come in as emergencies and we cannot operate on them. As at now that I'm speaking, we have to refer people to 37 because the instruments are not there. The list for today is being cancelled because everything is gone and it's not coming. And indeed, it's so frustrating to see patients who you want to treat and yet you can't treat them because there are no instruments. And I don't know what to do because today we've been sitting here all day just trying to put our heads together to get bits and pieces of instruments to operate on patients.
As the doctors power pressure from their frustrations on the hospital management, the patients will be the ones being made to bear the brunt. Kwetenati for Joy News.
Elsewhere, about 60 workers on the car power ship have lost their jobs. This includes 10 engineers who are staff of the Turkish company that constructed the power barge, and more than 50 workers with 2 subcontracted firms. The first barge arrived in the country last year as part of government's effort to end the crippling power crisis. The company is currently constructing the second barge, expected to arrive by September. But some Ghanaian workers there have already lost their jobs, as highlighted by this Business Desk report.
Sources say the company at the beginning of this month wrote to about 10 Ghanaian engineers terminating their contracts. The engineers who have been working with the company since November last year are reportedly to be replaced with new hands from Turkey for non-performance. Some of them have been speaking with Joy Business.
All they wrote was termination letter. It has no reason. The letter itself has no reason. The whole thing, when you read it, it doesn't make sense.
As my colleague was also saying, I'm also part of the mechanical maintenance team as well. I only know if contract should be terminated, it should be based on performance. Now, on what basis we were terminated, our contract was being terminated, we don't know. Who did the assessment on a contract, we don't know. So we don't really understand what is happening.
On the 4th, our HR met us and then she told us that by the end of April, almost half of the Ghanaians will be out of the company because the new management is saying there are too many people on the badge. So we asked her what is going to be the criteria, and she said Kapawa owes us no explanation.
There are about 30 Ghanaian engineers working on the car power ship, and more are expected to be laid off by the end of the month. The dismissed workers also complain about poor working conditions and discrimination.
The main problem is they can't speak the English very fluently, so it's more of sign language. But when you don't get them very well, they are pissed off. They try to throw off their hands to the extent that even I can't remember there was a time somebody has to even throw an object to a Ghanaian, which was very, very bad.
It got to a point they even had a staircase for Turkish staircase for Ghanaians. I mean, yeah, Ghanaian working on this staircase, so you know this is for Turkish only. Go and use the other staircase. They had times for us to go for lunch. It got to a point if you go, they said let the Turkish finish eating before you come and eat.
In February, A new country manager, Ekut Artis, took over from American Robert Kramer, who led the arrival of the batch to Ghana. In what the new management calls restructuring, subcontractors on the ship are said to have been ordered to sack some workers. Icon, an engineering firm owned by a Lebanese and undertakes maintenance works on the ship, has reportedly sacked 8 out of its 20 workers. Another firm, Blagodov, which undertakes cleaning services on the ship, is also said to have sacked about 45 of its total workforce of 80. Officials of Car Power have declined comment on the issue.
But you know, that's not the end of the story for us here, though. That's it for the AM News. For more news, kindly log on to myjoyonline.com. Talk about myjoyonline.com. We'll go during the headlines segment and look at some of the headlines that the news portal is showcasing today on its website. The newspaper headline up next here on the show. I've got your comments to share with everybody else, so keep them coming through. WhatsApp 0560 800,000. You're still watching the AM show.